Welcome to Spotlight. I'm your host, Josh Chapman. Today I'll be joined by Kristin and Maegan, and today's show is sponsored by Lake Huron Medical Center. Maegan, Kristin, how are we today?
Good. We're good.
Good.
Yeah.
It's beautiful outside and all of the things. So we're not here to talk about weather, thankfully, but we are here to talk about the great things going at the Lake Huron Medical Center. And you guys are both out of the North End campus, is that correct?
We are. We're at the endocrinology office up at the North Campus.
Okay, very nice. And so what is your role up there, Kristin?
I'm a nurse practitioner. Okay. I primarily work with patients with diabetes, all types, type 1, type 2, gestational, and then I also work collaboratively with Dr. Bala and Maegan, who runs our wellness program.
Okay, very nice. And Maegan, so you run the wellness program. What does that entail at the at Lake Huron Medical Center?
I do. So it's kind of a complex lifestyle management program. Okay. It's pretty much the only thing like its entity in this area, which is really awesome. It's medically supervised by 2 physicians, so that's what's great. My wheelhouse is really more looking at diet and exercise, and sometimes patients are interested in weight loss. So we kind of put all 3 of those things together. We do some really awesome body composition testing to really help pinpoint how many calories a person should be eating. We try to make sure that their diet is sufficient enough to make sure that if they're on certain medications, that they don't have any problems. And then we coordinate together and pretty much decide on what the treatment plan will be. Okay.
And so you guys talked about kind of the diet and the exercise and wellness. And there's some pretty unique things out there with GLP-1 drugs and things like that. So, as I age, I'm like, well, do I need to get on the calculator or the treadmill and stop eating all the things that I like, or can I just take this? Are you seeing a lot of GLP utilization instead of kind of that healthy lifestyle intervention, if you will?
Yeah, so our clinic is more focused on lifestyle modification in addition to the medical management. So we always encourage lifestyle modification first. Okay. The GLP-1s and GIPs that are coming out have been wonderful to kind of piggyback and help people on their weight loss journey. Okay. It's actually giving you back a hormone in the gut that you become deficient in as you develop diabetes, and it helps you feel more full and satisfied with usually smaller portions. Okay. So patients have responded really well, and a benefit is we get to decrease some of the pills. We get to, if you do well, and we also work in tandem with Maegan, and we see some lifestyle modifications, we can get some of the other pills that we're taking off, like some blood pressure pills, some cholesterol medications. And then Maegan's really great at working with patients when it comes to weight loss to ensure that they're not also losing muscle. So she helps to make sure patients are maintaining their muscle mass while they're on their weight loss journey, which is really, a lot of patients find that to be really important.
Okay, so you do kind of the clinical side, and then you kind of help marry both of those things of saying, hey, here's what we're doing on the clinical side, the treatment plan. Yeah. Here is how we can use things like GLPs, and if you're going to eat less, obviously you have to change what you're feeding your body and different things like that. So how has that changed the landscape? How has the landscape in diabetes and diabetes prevention changed in the last 10, 15 years?
So much has changed. I've been at the clinic almost 8 years, and just in the 8 years, the technology and the medical advances have been wonderful. We have a ton of patients that use the continuous glucose monitors now, CGMs, which just wearing those, we see usually A1Cs drop about a point because patients can just see what they eat and make some adjustments. And what I like to talk to patients about too is a lot of times you might skip your favorite food. Well, actually, maybe it doesn't spike your sugar. So these monitors really help us to identify the foods, and you can make changes. And we kind of preach moderation. I don't like to say you can't ever have this again, because personally, if you tell me I can't have it, I want it even more. Yeah. So to me, we're never you can't ever eat your ice cream again. You can have a little ice cream, but don't have a huge bowl every night. Have a bowl a week. So the CGMs are helpful because it helps people see, what things are maybe sabotaging their diabetes a little bit more than others. Yeah.
I've heard that I've had, anecdotally, I've dabbled in some of the CGM usage. Yeah. And it's so interesting that, when you hear, pre-diabetes and things like that, you get super scared. And you're like, great, I can't have a carb again, no bread, no great stuff. And the things that a patient can learn about themselves really it really puts into light the independence, or that everyone's physiology is different.
Yeah.
And what skyrockets one person doesn't do anything to another, and just the importance of it. And it really puts it into perspective, right?
Yeah.
It makes that portion control much easier when you're like, okay, like
Correct.
I don't have to eat the whole bag, like I ate
Yeah.
this, got me here, and like I'm cool with that.
I'm good.
Yeah.
Or what 20 minutes of walking can do after dinner.
After, yeah.
You know, I've seen so many lifestyle changes in that space of I walked for only 20 minutes, and
My
because we
blood sugar
think
went down.
I got to run 26 miles, that's it. You know, so so if folks are at home and they've struggled with diabetes, or they're having some symptoms, they took an A1C test, do they have to be referred to your office, or can they call and come in for consultation and things like that?
Yeah, they definitely have to be referred by a primary care physician.
Okay.
Yep.
So if interested, talk to their primary care.
Yeah, so we need a referral, and it can come in under obesity or diabetes. And then what's really nice is we're in the same clinic, so they'll see Meg in one exam room, and then they just walk down to see Dr. Bala or I in the same visit, same copay. So the convenience of it is really nice. It's not like we have to make a bunch of appointments. We just kind of double book everything.
That's awesome. Put the patient in the center, and great things
Yep.
happen. I love that.
Yeah.
Well, I appreciate you guys taking the time to come and talk to me, and good luck on your work.
Thank you.
Josh.
And thank you for joining us on Spotlight.